Hey everyone, my name is Julian. I'm a board certified music therapist, and today I would like to do a very casual and concise video on my definition of music therapy and what it looks like for me in my experience on the day to day. So I wanted to give you a little background. My training was completed at Western Illinois University, finished my internship at the Oregon State Hospital in Salem, which was a psychiatric facility, and I have been working I work in hospice now. I've worked primarily with adults, with a variety of populations from drug addiction, veterans, high functioning, low functioning, acquired brain injury, schizophrenia, Alzheimer's patients, bipolar, split personality, and probably missing a few, but like I said, I work in hospice now. It's great. So I don't feel like I'm an authority, but I feel like I've been around the block long enough to say a few words on it. What is music therapy for people who don't know, or for people who are curious about music therapy but want to learn a little bit more about it? If you go on the Certification Board for Music Therapists website, there's a very lengthy and clinical definition of what music therapy is, and everyone has their own little elevator speech on what music therapy means to them. But for me, music therapy is using music to achieve a non-musical goal. Plain and simple. And when I was a freshman 15 years ago, I remember hearing about music therapy and thinking, oh wow, you play music for people. How great. But that's not all that music therapy is. And it's a vital part. Musicianship is a vital and undebatable part of music therapy. But there's so much more to that. It's also, it's like a cocktail of what makes a full music therapist. It's like 1 part musicianship, 2 parts clinician, and maybe like a splash of FBI agent. And I'm going to go into why I said that later. But first, let's talk about the musicianship part of music therapy. Okay, so yes, in music therapy, you are part rock star. You're also part KJ. You're walking around the room sometimes, getting everyone in the room to sing with you. What's your name, sir? And what's your favorite song, ma'am? And everyone sing with me. So there's part of that. Depending on the setting, you might find yourself being a choir director or teaching guitar lessons, all with a therapeutic, overreaching goal in mind. So that's a key ingredient to being a music therapist. And your skill level at minimum has to be par. I mean, you can't be looking at your hands or down here on the keyboard, because you might be missing really vital things that are happening within the session. There might be someone who hasn't spoken for years who's singing along with you, but you're missing it because your eyes are down here. And what a loss! How terrible would that be? So it's important to have enough musical skills that your eyes are up here and you're assessing and taking in all this information. Okay, that being said, if you are just starting out in your curriculum for music therapy and you are finding yourself still unable to look away from your hands or your keyboard, don't panic. Just keep practicing and keep showing up and doing your half of the work, and time ripens all things. You will get there, and I believe in you. Okay, so once you have your strong musical foundation, that allows you to become the best clinician that you can be. And so right off the bat, when I think of like a professional therapist, I think of someone who is able to put a cap on their baggage and their emotions and all of their drama when they get to work. And that is such an important thing that really levels you up in your professionalism. And no one cares if your child put your car keys in the washing machine and that's why you're late. When you show up and you're in front of your patient, it's about them. It's not about you anymore. So being able to separate your personal life from work. Also, being a music therapist requires you to figure out your therapeutic approach and really hone in on what your skills are and what your challenges are as a therapist. And ask yourself, like, am I more authoritative or am I naturally inclusive? And doing a lot of listening, you're letting music do a lot of the work. But aside from that, you're also doing a lot of validating, a lot of redirecting sometimes, or just a lot of listening and taking in and maybe reiterating a lot of, like, I'm hearing you say these things. There's so much I'm not mentioning here and so much I'm leaving out, but this is just what I can think of at the top of my head. And then I wanted to kind of double back to what I said about being the FBI agent and why I kind of use that analogy here. When somebody gives you a referral and you study everything about that patient, you read their file, you seek out guidance from their village, like their caregiver, their nurse, their daughter, the family, the friends, the neighbor. So you kind of have like an understanding of what everyone else has diagnosed or said about this patient. But when I walk into the room, yes, I'm like looking around at their living conditions, but I'm mostly like honing in on this patient. I'm assessing everything. Like, no joke, I'm taking in their breathing. Is it raspy? Is it shallow? Why did they say what they said? And why did they say what they said when they said it? It's like super detailed. I'm gathering, are they bedbound? What equipment are they using? Do they have any other like assistive devices? Are they on any medication changes? Are they experiencing any sleep changes? Are they spiritual? What kind of music do they like? And this helps me not only to figure out, what kind of music they like, which there's so much research showing that patient preferred music is the most effective, but it also gives me information to connect with my client on a person-to-person level, and also helps me gain trust in that session. So I always try to meet the patient where they're at so that they can trust me and we can have the best outcome possible. And I remember back to my early training when I was a music therapy student and I'm having my practicum sessions. My professor would sit in the corner of the room and just observe me and document every single thing that happened. And at the end of the session, she would come up to me and hand me a stack of papers that looked like she just transcribed the Nixon tapes. Like, it was so detailed. It was like 10:45, patient said this. 10:46 a.m., therapist responded this way. Why did she respond this way? 11, therapist finally asked the question that opened the emotional floodgates. 11:05, therapist offered closure by saying this thing and singing this song, whatever. But it was super detailed, and I know it sounds harsh. I know it sounds like a harsh thing to do to like a young student, to be like, here, read everything that just happened that you did. But actually, that was so vital for my education because it gave me a visual example of how much data I should be taking in. And it also helped me be better at documenting. So that's why I said it's kind of like an FBI agent where you're just there trying to soak in as much information and data as possible and remember everything. And sometimes when you have 50 or 100 patients, that's hard, but you keep a notebook and you maybe write initials down and a few notes, or some information, like maybe keep a log in your password protected computer to help you remember. But eventually, you magically just like retain everything. It's like a weird thing about being a music therapist. Um, but again, time ripens all things, and these are just some notes that I have about the reality of my day to day and what it kind of looks like. The other thing that I wanted to talk about was the work life struggle and the amount of self care involved. I didn't realize going into this field how much self care is necessary. So let's say you have a really good session, and the client is reaching all of their goals and their quality of life is like sky high, and you're doing awesome, and you leave feeling like a worthwhile human being. And you go home and you can't really talk about it to anyone because it's a HIPAA violation, it's a privacy breach. And also, you don't want to poop where you eat. You're bringing your work home, and that's not cool. And the sad thing is that the sad reality is that no one will care about the session as much as you do. Maybe you and the patient. And that can be very lonely. Which is why it's good to have friends that are music therapists. It's good to have friends in the field that you can talk to without giving too much information, of course, because they can understand. They know what you're going through, and it's just good to have that support group. So I really hope I didn't deglamorize anything in the process of making this video. I will say that this is the coolest job in the world. It's the most fulfilling job in the world. And I honestly can't imagine myself doing anything else. Hope this video was beneficial to some people. If you want more videos, let me know. Besides that, thanks for watching, and I hope you have a great rest of your day. Thanks.